the next large group of organisms we're going to talk about, for the majority of them, one of the things we're going to focus on is gastroenteritis. So before I start talking about Campylobacter, I'm going to help you differentiate between a lot of these organisms, okay? Now, there are generally, when we're talking gastroenteritis, the two main things you're going to have to differentiate between are the watery diarrheas and the bloody diarrheas, okay? Now, Campylobacter is one of the causative agents of bloody diarrhea, and the reason that it causes that bloody diarrhea is because it invades the mucosa, okay? So, organisms that invade the mucosa, okay, cause typically a bloody diarrhea where you're going to have blood and either they'll mention pus or PMNs in the stool. The pus and the PMNs is due to the fact that you have invasion, you've got inflammation, and you're going to have that accumulation of neutrophils, okay? What goes along with that, of course, is fever. So if you have an invasive organism, you have that inflammation, a lot of the times you're also going to have an accompanying fever. So for the bloody diarrheas, with Campylobacter being an example, Shigella being another example, in general you can say that the bloody diarrheas are invasive. Now there's an exception to that rule, and that's enterohemorrhagic E. coli, okay? But I'll get to that when we start talking about the Enterobacteriaceae. Now, watery diarrheas, we're typically thinking, number one, toxin-mediated, like ETEC, like cholera. We're thinking viral gastroenteritis, like Norwalk or rotavirus, okay? You can also think parasitic infection, but here's the caveat for parasites. When you see someone with persistent diarrhea, think parasite. P persistent, P parasite. So those are going to be some of the things that as we go through all of these organisms that I'm saying cause gastroenteritis, you can help differentiate one from another. All right? So with that, we're going to start with Campylobacter. Campylobacter is one of those gram-negative rods that's just a little bit different than the ones that we've been talking about. It's a little bit different because the organisms, as you can see in the image, are curved, okay? One of the buzzwords that you'll sometimes see in a vignette about Campylobacter is you'll see the term gull's wings. So the organisms on a gram stain, because they're curved, and if you get two that get close together, it actually looks like one of those very simplistic drawings you used to make as a kid of a seagull, okay? So gull's wings is kind of really the buzzword there for the Campylobacter gram stain. Now, these are also oxidase positive, again, that may help you differentiate them from some of the enteric organisms we're going to talk about in a little bit. And the species we're going to talk about predominantly is Campylobacter jejuni. What are some of the distinguishing features for Campylobacter? Number one, it's one of those micro airfills that we talked about. So it likes a little bit less oxygen and a little bit more CO2. Another thing I'm going to point out is that Campylobacter grows well at 42 degrees Celsius. Again, I know you're like, wow, that's really minutia. Yeah, thinking about different growing temperatures might be a little tedious, but stick with me on this one, all right? You've got a patient that have gastroenteritis. You want to culture, you want to find out what it is. So you isolate the organism from the stool, and you put it in culture at 37. What's going to grow? Everything is going to grow at 37, all right? So what's going to happen when you put it at 42 degrees is you're going to inhibit the growth of a lot of those other organisms, and basically you're going to select for Campylobacter, all right, because it can handle the heat. So the fact that it grows at 42 can be used in the selective identification of that organism. Now, the reservoir for Campylobacter jejuni, probably the most important one that you need to know, is poultry. That's probably the primary means of transmission, although it can also be transmitted fecal-oral, okay? But really, if you're given a case and you're pretty sure it's Campylobacter, and you're asked what the most likely means of transmission was, it was probably from eating contaminated poultry. All right, pathogenesis. This is important for Campylobacter. It describes the invasive nature of the organism, but if you look at the very first bullet point up there, low infectious dose, what that means is that these organisms are generally acid resistant. So you don't have to swallow a whopping dose of these to actually initiate an infection. They're acid tolerant, so as they go through the stomach, they're not destroyed. As they get to the intestines, then, they're able to very easily initiate the disease. Now, as I mentioned, they're invasive, so they're invading the mucosa. You're getting blood and pus or PMNs, which means you have this inflammatory or invasive diarrhea. All right, so that's very common with Campylobacter. This particular species does not usually penetrate to cause sepsis, although there are other species of Campylobacter that can do that, all right, but they're much less common. The disease for Campylobacter jejuni is bacterial gastroenteritis, and here's something that's very important. It's the most common cause of bacterial gastroenteritis in the U.S., all right? Now, what does that mean exactly? Does that mean it's more common than Staphylococcus aureus? No, but remember, staph is an intoxication. Here we're talking actual infections. What that means, you're going to have a little bit more of an incubation period, so more along the order of 1 to 2 days versus 1 to 2 hours with the intoxication. In the U.S., Campylobacter is actually more common than Salmonella and Shigella together, all right? So if you get a random kind of nondescript case of bacterial gastroenteritis, they don't tell you anything about the culture, they don't mention the 42 degrees, they don't mention the gull's wings, they just say, hey, what's most likely? In the U.S., what's most likely is Campylobacter, okay? So there's one of the most commons that you need to know. Now, the disease consists of 10 or more bowel movements a day that are bloody. Again, you're going to have pus in there as well, and the accompanying fever, again, because of the inflammation. Now, the good thing about gastroenteritis, you're thinking, is there a good thing? There actually is for you. Most of the time, treatment is self-limiting, so you're not going to prescribe a wide variety of antibiotics in the case of gastroenteritis. They're typically going to run their course. All right, so in this case, it's usually 3 to 5 days. Okay, so the treatment is usually just self-limiting and supportive care. Now, one of the high-yield facts that you need to remember about Campylobacter is that it is associated with Guillain-Barré syndrome. Okay, now about 30% of Guillain-Barré in the U.S. is attributed to previous infections with Campylobacter. So there's a little bit of cross-reactivity here, or in immunology we might call molecular mimicry, where the antibodies that are made for Campylobacter cross-react with neural tissue. So you get Guillain-Barré, you get kind of this ascending paralysis, and you're going to have to make the connection to Campylobacter and a few other infectious agents, and we'll talk about those as we get to them, okay? You can also have a reactive arthritis due to a previous infection with Campylobacter as well, all right? But Guillain-Barré is typically one of the high-yield facts they like to test on for Campylobacter. How are we going to diagnose it? We're going to put it on Campylobacter medium, so they're probably not going to ask you about the medium. We're going to grow it at 42 degrees. So we're going to inhibit the growth of a lot of other organisms that normally grow in the gut. Treatment, first bullet point, mostly supportive, and we're going to treat it with fluid and electrolyte replacement. So you're going to say, hey, go get some Gatorade, some Powerade, keep yourself hydrated, and probably within a week it should run its course. However, if you have someone that it seems to be lingering on, someone that's immune compromised, some of the drugs that are commonly used are the fluoroquinolones and erythromycin. All right, the organism tends to be penicillin resistant, so you wouldn't probably use a penicillin.